All content, including opinions and views expressed, are ours alone and does not necessarily represent the opinion of the City of Wilmington or its employees. The City of Wilmington has not approved of and is not responsible for the content of this podcast series. Thank you and enjoy the podcast.
Welcome to The Cop and the Shrink, a podcast exploring mental health, law enforcement, and societal issues from the perspective of a police officer and a mental health professional. Have questions about current events, social media, mental health, or police matters? Visit thecopandtheshrink.com. Let's get this episode started with your hosts, Harold Bozeman and Dennis Carradine.
Hey everyone, welcome to the Cop and the Shrink podcast. Actually, today is the Shrink podcast. But first, before I tell you what's going on, let me tell you this. Visit us on the web at thecopandtheshrink.com. Send us a message if they have any comments or whatever, or any things that you want to hear about or have us talk about. Please do that by just simply sending us an email or put it in the comment section. So let's go to just me for a second. Our producer Denny and I are just here by ourselves today because the cop, Bozeman, Harold, our buddy, is out and unfortunately decided to catch himself the vid. He has corona, but God bless him. He's doing well, but just couldn't make it in today. So we're going to do a version of the Cop and the Shrink with just the Shrink today. Not a bad deal. Kind of go over some things, talk about a few current events and a few things, just kind of riffing on my head. But we will get back to the normal, the Cop and the Shrink, as soon as possible. We wish him the best of health. Obviously, coronavirus, this COVID-19 pandemic is still alive and well. We are when we do the podcast, we're in the Northeast. We're in Delaware, and the reality here is that this surge that we've had lately has become very problematic. We are seeing people literally dropping like flies with whatever variant is of this week. I've lost count. I don't know what number of variant it is. It's hitting pretty hard, and I've seen it in my private practice. I've seen it just with friends and family that, this surge is real. It's nothing to be joked around about. So please make sure you keep yourself safe. Make sure that you're following all guidelines that your city or state has put out for you, and just kind of keep cool. This sucks. Let's be honest with it. We're now almost approaching that 2-year mark of our 2-week shutdown, right? And the funny thing is that as we talk about this, we also have to understand people explain it in different ways. So if you hear someone say, hey, it's the quarantine, do you remember the quarantine? Those are folks that are pretty in tune with the medical world. They're pretty in tune with the science and so forth. That's the quarantine, Then you hear people say the lockdown, the lockdown for that certain amount of time. And typically those are folks that, have kind of railed against government at this point because, look, let's be honest with it. Anytime that you politicize a virus, we're going to have some issues here. So they say the lockdown because they felt locked down. God bless, we understand how that works. And then finally, folks like me, I think, was the shutdown because it shut down business and it shut down industry. And that was, although that me being in healthcare was very, very upset and sad and continue to be that way with the loss of life and everything going on. It was the shutdown. It was shutdown of society, the shutdown of those businesses that ultimately created, our sense of disconnect. And in multiple podcasts, Harold and I have talked about where people forgot how to people. And we see that day in and day out. Now, we have an impending storm here on the day of our podcast. We have an impending storm. And that impending storm is supposed to dump a couple of inches of snow on us. And if you truly want to believe or truly want to see how people forgot how to people, go to the grocery store anywhere in the Northeast right now. The French toast raiders are coming out in droves at this point to get their milk, bread, and eggs, and I guess live off of. I don't know. I don't think we ever did it growing up. I don't think I did it with my son or daughter growing up, that we just sat home and ate milk and bread sandwiches or made French toast during this time. And here's the deal, is that typically here in the Northeast, if we are snowed in, we're snowed in for what, a day or two? About that, maybe an hour or two, who knows, because I want to break loose. So when they go out and they buy everything off the shelves that are perishable, wouldn't you think, maybe it's just me, because ultimately, I do believe in the zombie apocalypse, is that you should buy non-perishable items, buy canned goods and things like that versus, stuff to make French toast with, during a snowstorm. But comfort food rocks, whatever, I get it, and so forth. So a little bit of a different climate today, and we're going to see what happens. So we got the surge of the pandemic. We have winter. Winter means it's cold and it will snow. But folks, you have to take care of yourselves. So our first topic here, and again, wishing that Harold was here, very upset with this, and I know that he would get into this topic quite well because I know some of his stance on it. We've known each other a long time, so sometimes we can finish each other's sentences. But I wanted to talk a little bit about the hero mentality, not necessarily the hero mentality from our first responders or our healthcare workers, but the hero mentality that we, as your average everyday citizen, have when it comes to those first responders and those healthcare workers. We have heard the term hero thrown out so many times here, and to be honest with it, I had to castigate myself a little bit when I started thinking about this topic because we run the Hospital Heroes Food Drive, which we'll talk about in our second section. But I kind of castigated myself. I reprimanded myself because I wasn't really paying close attention to really what we're saying. So fraternity brother of mine, Steve Sowers, the other night had put up a post. And it was a good article in his post about how the healthcare system is filled with humans, that we're putting our healthcare folks to the breaking point. And if you don't believe that, then visit your ERs, visit your hospitals. Number one, you're not going to be able to get in. But two, you're going to see that we have low staffing, short staffing. We have burnout. We have people that have decided they wanted to go into a total different field because of what's going on right now. Our healthcare system, someone somewhere along the world said, "Oh, we're on the brink of breaking the healthcare system." And I called bullshit on that quickly. Our healthcare system has broken. Look, this has nothing, not one thing, and everything that I'm going to say here on out has nothing to say bad or poor against our healthcare workers. Not one thing. I hold them in high reverence, just as much as I hold every first responder in high reverence. But our system broke, and it wasn't because of them. It wasn't because of the workers. It was because of everything else that went around with it. So our system has broken, and it's sad because now we're seeing it where around here, emergency departments are closing. Hospitals are closing. When we are at our extreme need during this latest surge, we're seeing systems that have completely shut down. So back to my fraternity brother, Steve. Steve posted that article, and I wanted to give you his quote, what he had posted. In that article, Steve had said, "For a long time, I hesitated posting something about this," which he was talking about the article, "because I was afraid somehow it would take a political turn, which is the last thing I'm interested in. The dissemination of healthcare right now is a very, very real thing. I personally know a lot of people who have recently left or are actively planning to leave the profession for good due to absolute burnout. The problems in healthcare absolutely precede COVID times, but this pandemic has beaten down so many of us. It was bad enough when we had to deal with the constant do more with less. Just got worse and worse every year. Well, we went into this pandemic with basically a skeleton crew at so many positions." So this was the crux of it, is that prior to us going down into the quarantine, lockdown, shutdown, whatever you want to call it, prior to us going down to it, our healthcare system wasn't the healthiest. We literally had kind of a downplay of people getting into nursing, getting into healthcare itself because of just life. Look, you got to look at it. They're not the highest paid people in the world, but they are demanded so many things, and demanded of themselves. It's the same way with first responders. Whether you're a cop, whether you're a firefighter, whether you're an EMT, paramedic, you're not the highest paid person in the world, but you are doing the work of 10 people. That's kind of historically how it was. Most people, and we've gotten into this in other podcasts, most people do not get into the first responder world because they believe they are going to make out or make bank with it. You're not going in there thinking, wow, I'm going to make $1 million or $2 million being a street officer. That's not how this works. Most healthcare people also get into it understanding that, yeah, you're going to get a decent wage, you're going to get paid well, but you are going to work your tails off with it. So I read that article, and I replied to Steve, and I had to step back a little bit and think about my reply, and then also where this all went. And quite honestly, there's a lot of things that keep me up at night. There's a lot of at any good point, my brain is like a bag of ferrets fighting each other. I am constantly thinking about stuff. But this one had me up for a little while, thinking about kind of not just my post, but what I was feeling about this. I replied to Steve and I said, I cannot count the number of times I've had to pick my healthcare patients off the floor as they break down in front of me. A person can bend only so far before they split in half. It literally crushes me to see my friends, family, and even my spouse who are in healthcare positions endure these difficulties over and over again. Healthcare workers did not sign up for what is happening, nor did they sign up for some of the disrespectful treatment. Something has to give. I just wish I had answers. So I kind of went back a little bit, and I think heavily about this stuff. And when I say I think heavily, it's like, look, my mission in the world, I think I was designed to just help people and try to do something for somebody, whether it's in a charitable sense, whether it is in therapy or whatever it is. But my whole purpose in life is to help. And when you feel helpless, when you feel that you can't help anymore, that becomes a problem. That not only becomes a problem for me, but it becomes a problem for us in general. So a couple of ideas kind of hit me a little bit. A couple of thoughts put me almost in this quicksand, and you know what a quicksand is. It's that you think of one negative thing, another negative thing, and another negative thing, and then eventually you just can't get out of it, and you're just kind of falling down a little bit. So I started thinking about that, and I asked myself, are we realistically looking at healthcare workers as human beings with limitations, or are we throwing them in this hero, the superhuman status, incorrectly? Look, what they do is absolutely remarkable. What they do is something that most of us can't do. I hate to say it, but it's well, no, I don't hate to say it, and Denny's heard this story a million times, but I will say it. So my wife and I went to Florida. We went to Hawaii. Very similar to Florida, Hawaii. We had gone out to Hawaii. On our plane ride back, and I say this not to sensationalize or anything, but to sensationalize it would be one thing, but how badass it was is a whole other thing. So my wife's a nurse practitioner. So we're flying back. We are 30,000 feet in the air. And on the loudspeaker said, is there a doctor in the house? Is there somebody here that has medical training, that is a medical doctor? And if anybody, now you got to put it this way, some shrinks, we're narcissistic. Let's be honest with it. We have some God issues and so forth. But I almost wanted to defy anybody that had a PhD to stand up and says, I'm a doctor. Or if I stood up and went over and said, hi, I'm a doctor. How are you feeling today about this? I would hope that somebody would punch me in the face at that point. So I literally point over to my wife and I'm like, can you help? She at the time was, I think, 7 months pregnant. Got up and literally ran IV on this guy, pushed meds, was talking to this Sky Doc, they called him. It was kind of wild. It was very Star Wars-esque, right? The Sky Doc was the doctor that was in charge of all the flights and any medical problems. And I looked at that, And I mean, my God, it was so badass. It was just amazing to watch her do that. And then when we talk about it and I tell people about that, people are like, oh my God, that's so badass. And then they look at me like, what do you do? And I said, I held the IV bag. I had training before. We didn't do much, right? Her response, which I think is always, funny, her response is, I do that every single day. I push medications every time I go into work. I help people with cardiac issues and help people, kind of get rhythm back into their chest. And I thought about that and said, you know what? It is. You're doing that every day. That's your job. But for us, we sensationalize it. We look at it and think it's just amazing to it. And I have to understand that they're just doing what they consider their job. So here comes the problem. If we are, for some reason, perpetrating a horrible notion that our healthcare workers are these heroes, then are we pushing them beyond their human capabilities? Are we pushing them to not only a breaking point, but a complete shattering point where there's nothing less? So I looked up a couple of things, and I found Anna Wexler, who's an assistant professor of medical ethics at the University of Pennsylvania at the Perelman School of Medicine. She had made a quote, which I wrote down, and I'm going to read it to you. We're doing a lot of reading today, Denny. That's what we're doing today. She said, more perniciously, the hero narrative perpetrates the false notion of healthcare workers as inherently altruistic, as individuals who will accept the unbridled personal risk no matter the cost. But in the face of hazardous conditions, there may come a point at which they may not be willing to endanger their own health, nor that of their partners, children, and even their parents. In the absence of adequate PPE, how much risk can we reasonably ask healthcare workers to take on? Within the healthcare worker as a hero narrative, the decision not to work or to work less, to work in a different hospital, or even in an alternate capacity such as telemedicine, is nothing short of taboo. It is antithetical to the selfless healthcare worker stereotype. That was huge. That was huge. And my thought is I started asking around. This was probably, this was prepping for the podcast, and I asked our healthcare workers and so forth, kind of what's going on here. And all of them said the same thing, is that we're tired. We're exhausted. We're done. We've known personally several that have gotten out of healthcare completely. We've known others, especially nurses, that have gotten into travel nursing because they can make more money and not necessarily be in the hot spots of COVID. So we have to understand this, that most of the nurses that are leaving healthcare, most of the healthcare workers are not because of mandated vaccines. That becomes a hotspot in the media or whatever it is. They're leaving because of burnout. They're leaving for better pay elsewhere. They're leaving to not deal with this bullshit that's going on with them. I've been in the hospital enough times to see how disrespectful people are to them. I can never figure this one out. And this is just me in the world. I'm a 20 to 25% tipper guy when it comes to servers at restaurants and so forth. Always have been. They're doing a job. They're doing the best way it could. But people bitch, complain, and moan about everything at restaurants and then put it on the server. And the server's just trying to make a wage. The server's just trying to get by, trying to live their lives, but yet people bitch and moan to them about everything. I've watched people, basically you walk into some whatever restaurant that you're going to spend the $50 bill on people and treat that server like your servant. Like for some reason they owe you something, the entitlement factor. The problem with that mentality is that you're seeing it in healthcare, and you're seeing it over and over and over and over again. You're seeing it where people are coming in that may not be the sick of the sickest, but definitely are entitled, that they get to the hospital and dare I use the cuss words, but they act like complete assholes to the healthcare provider. And why? What's the reason behind it? So eventually, they're done. They are literally done. Now, we have this pandemic that's going on that I swear to you that into most of the ERs, it looks like a George Romero zombie film. And Denny knows that's reference to it. So George Romero did did Night of the Living Dead, right? And they were the slow-moving zombies, right? And I don't know who's a director that does like the Rage, that did like 28 Days Later. He's a English director. And even like sometimes The Walking Dead, they have them like running, right? I don't know who he's going to look it up for me. But this George Romero film, if you remember just that slow kind of walk, you're that opening scene when you're in the cemetery and the guy comes out and says, "Oh, they're going to come and get you, Barbara." And then the guy's just slowly walking, eventually gets to you and eats your brains. That's a George Romero film where zombies were slow walkers. And then these other producers kind of put out there that they had the Rage, or they were running at you, or whatever. Did we find one then? What do we have? 28 Days Later and the director. It doesn't matter. Danny Boyle. Oh, okay. Yeah, Danny Boyle. Excellent director. So if you watch a Danny Boyle film like 28 Days Later and so on, it's these running, like these zombies are coming after you, right? So healthcare right now, if you go to the ED, you're seeing a George Romero film. People are slowly coming up. And look, we also understand that with COVID at this point, COVID doesn't care. COVID's one of those diseases and those viruses that really just doesn't care. It doesn't care about you politically. It doesn't care about you if you were straight, gay, whatever. It doesn't matter. It's a simple virus that wants to kill its host. Not many viruses do that. It's a virus that wants to kill its host. It's wild. And then this virus pops in and pops out. You may have certain symptoms. You may have the cough, the fever, the sweats, the whatever it is. You may have simple symptoms. You may be asymptomatic. You have nothing. Don't even know that you have it. Or this thing kills you. Truthfully, people that go into the hospital at this point that get vented, they don't have the greatest chance of coming off that vent. So we have to understand that we have a virus right now that doesn't care. We have a system that's pretty broken right now. And in the middle of it, we have our healthcare workers that are burnout, that are tired, that are exhausted. I can go, literally on for days about how we have to change this stuff. But even me, I rarely complain about work. I rarely complain about my caseload. I normally keep a much higher caseload than probably what I should. The normal everyday therapist keeps about 35 on their caseload. I'm probably at 1,000. But I love seeing people. I add people in. I rarely complain, but I have also noticed myself breaking down at times because of the anxiety and depression that we're seeing in our healthcare workers, that I've had to pick these nurses up off the floor, these doctors, these other therapists, these first responders that just can't take it anymore. And quite honestly, are they heroes in our hearts and our minds? Absolutely. But we have to understand that they are human, and that's all they are. So in my darkest moments, which I rarely talk about, I find myself in my office, sometimes crying, sometimes angry at the world, sometimes just completely exhausted. I try to take my drive home from the office where I live versus where my office is typically about a 35, 40-minute drive. And I try to decompress. I try to do things to kind of get my head set so I can get to the house and be okay. But what I found recently is that I am exhausted by the time I get home. I mean, literally, mentally, physically exhausted by the time I get home because of these crazy rates of anxiety and depression that we're seeing. So, in all truth, kind of wrapping this up with this section, and then we're going to move into the Hospital Heroes food drive, a little bit about that. But remember this, and remember, if nothing else, if you take anything away from my rantings today and learning about Danny Boyle and George Romero films or anything like that, you have to understand that we use that word hero to honor them. But we have to remember, and beyond anything else, that our nurses, our docs, our frontline workers, they are human. And to that end, each and every human has a breaking point. And maybe some of them are at it, maybe some of them are damn well close to it, but we have to remember that they are at a breaking point. And we should encourage that self-care, telling them to take the days off that they need to, take a moment away. We should encourage not only those breaks, but literally encouraging them to seek out the mental health needs. Right now, I've always said I'm not a huge fan of telehealth, but if that's all they can get, then get them in with teletherapy. If not, get them to a therapist or whatever. Everybody needs that help at this point. It's been horrible. And then, remember, you should care. Just understand that not only are you human, they are human, that we're all in this together, and make sure that you show them that you care in any way possible. Whether it's providing a meal, if it's your spouse, doing, laundry for them, whatever is needed, make sure that you show them that you care. Cool. So we're going to get into the next section. The next section is going to be about our Hospital Heroes food drive, how you can help out a little bit, and we'll go from there. Again, this is Dennis from the Cop and the Shrink today, and we're wishing the best of health to Harold, who is home recovering from COVID. So we will be back. Thanks for listening to the Cop and the Shrink. You have seen their faces and read their stories. Our hospital heroes and first responders are remarkable, and their strength is inspiring as they continue to work around the clock in the fight against COVID-19. Our mission is to show these frontline workers that we support them through the simple act of providing them with a prepared meal. For a $6 meal donation, you could help a hospital hero in a struggling restaurant stay focused and positive through the COVID-19 pandemic. There is a light at the end of the tunnel, but we still need your help to see our hospital heroes through this fight. Our heroes are why we do what we do, but you are the how. Text Hospital Heroes to 44321 to donate a meal to a hero. Please visit us at hospitalheroesfooddrive.org to learn more about our mission. All right, we're back. Hey, thanks for listening to The Cop and the Shrink. Make sure you follow us on thecopandtheshrink.com. Check us out on Instagram, Facebook, all our social medias, and check out our vibrant TikTok. Lately, the TikTok has been dedicated to strange laws and psychology facts. Once Harold's feeling better, he's going to be on the TikTok with us. But go over there. It's under The Cop and the Shrink. Kind of fun. We've been watching these TikTok followers build up and all that. We are not at TikTok famous yet, but we were hopeful. We just need another 1 million people to make us TikTok famous. So if you're just tuning in, it is just the Shrink tonight. The Cop, Harold, he is out with COVID. We wish him well. We wish him all the best recovery. Again, bad virus. We know this. It hits everybody a little bit differently, but he's going to be okay. He's just got to get through it. So a couple little shout outs before anything else. Always wanted to shout out to our buddy Jim Wyatt, one of our officers in the world, that you need to go check out his website. It is ourgreatcigarreviews.com. He has this really cool merchandise. I will show you. Boom! If you can see it, there it is. If it's on the web, if you're not watching us, then it is a T-shirt with great cigars. He has the Cigar and the Beer program, which ended up helping us, helps out the Hospital Heroes food drive, helps out the Trauma Survivors Foundation, helps the Cop and the Shrink. So we got kind of one of our first sponsors with it. So please check it out, greatcigarreviews.com, and we're going to go from there. So I wanted to do our next section. We started talking about it on the first one, to do it a little bit on the second and talk about some of the things that we have rolling. And one of the things that we have been, oh my God, just absolutely blown away with has been our Hospital Heroes food drive. I wanted to give you the background, obviously give you a little bit more in the elevator pitch about it, kind of what it is and what's going on with it, and how you can help, and how you can help our first responders and our healthcare workers with it. Kind of cool at this point when I looked at it and I tried to put all the numbers together. So you could check it out. It's hospitalheroesfooddrive.org, but you could check it out. Right now, based on this program, we have delivered approximately 31,000 meals to 70 different locations, and we've gone anywhere from D.C., New Jersey, all the way down, or I'm sorry, they're not even close. New York and New Jersey, all the way down to Washington, D.C. Just recently, we were down at Beebe Hospital down in Lewis, Delaware, feeding the emergency department with our partners at the Big Oyster Brewery and with the Cinnamon Bun Exchange. But this program's kind of cool. What it started as, or at least developed, was something very, very, I want to say selfish. Is that bad to say? But I'm going to say it. So early on in the pandemic, my wife was working at Jefferson Hospital in downtown Philly. If anybody knows about Jefferson Hospital down there, it was one of the hardest hit hospitals. That, Penn, and a couple other ones, where they were just getting inundated. Really, at the beginning of it, if you look back in February, March of 2020, we didn't know what was going on. We really didn't know much. We were joking about it the other night, as some of the things that we did back then versus what we do right now is all way different. Like, if you could remember people bringing home their groceries and then taking Clorox wipes and wiping down all the boxes and so forth, that we believed if you touched somebody it was going to get it, and then we found out that it's an airborne virus. So using all that to wipe down your fruit probably wasn't the best thing, but hey, whatever, you got to do what you got to do. But early on, there was this inundation of the healthcare system, and then we started seeing people coming in droves. Then the shutdown happened, where restaurants were shutting down, cafeterias were shutting down, and I very, very much remember the cafeteria at Jefferson Hospital had completely shut down. There was nothing in the vending machines. They literally, all the stuff was gone. Whether it was patients or other healthcare workers, they had nothing. They really had nothing there. And so I contact my wife. I was seeing patients. I was actually doing some crisis work in New Jersey based on certain things that were going on there. And then I was called into Philly for more crisis, and I caught up with her, and I said, "Hey, have you eaten today?" And Laura just said, "No, I think somebody delivered pizza somewhere," and that was crazy to me. So I thought, okay, what can we do? So the first thing I did was call a buddy and said, "Hey, can we get something together?" Our first donation was, I think, 125 burritos. And that was what we just kind of figured out. We had 125 burritos. We're going to give it to the emergency staff and make sure that the emergency staff could do this. And then I started getting phone calls, of people saying, "Hey, let's get this together." So Ray Sheehan from Upcoming Events. I was getting John Schaefer, Rob Wright, all from Flight Entertainment. These are folks that we've done tons of events with before, and they wanted to help, and they wanted to figure out how. So that's kind of where the Hospital Heroes food drive started. And then next thing we know, we started partnering with the different restaurants in Philadelphia. At that time, nobody else was doing this. No one else was even attempting to do it. And probably because of the fear, of catching this and being able to go around not really having the context. So we were kind of one of those first games in town that were going to the restaurants and then bringing food in. And we established a website. We had established a way to start donating food through the website, and we started establishing our partners. At this point, in the game here in January of 2022, we have had about 100 restaurant partners that have helped out. Like I said, we've delivered 31,000 meals, and we have continued to focus on this. We have continued to put it into place. The cool part about it is that every time that we do this, you see smiles. I know everybody's wearing a mask, and it's really difficult to see those smiles underneath those masks, but they're smiling. We've had people shed a tear saying, "Wow, you actually care about us. You actually do something." So I will always say that we are getting, we're getting a lot in return from this. Not the monetary stuff, but just the good feels to it and what have you. So we have done police stations, fire stations, EMS. We have done multiple times. One thing that we did really cool, and this was only a few weeks ago, is that we did a cheesesteak day for first responders here in Delaware, where we ended up getting a food truck, our Woody's on Wheels, came up to the Wilmington Police Department. We ended up feeding Wilmington Police, St. Francis EMS. We fed Ellesmere Police. I think Delaware City Police came up. And then we brought, from the Maryland Avenue Sub Shop, which is here in Delaware, we brought cheesesteaks and chips and pretzels and all down to the Newcastle County Police, the 911 Center, paramedics, even over to the Newark Police Department. In one day, we had sent out, I believe it was close to 400 to 500 meals in one day. It was amazing. We had one where KFC got involved, Kentucky Fried Chicken got involved, and we had, I believe it was over 500 chicken meals that we had, or fried chicken meals, that sounds bad, fried chicken meals that we had delivered to 4 different hospitals here down in Delaware, at Christiana Hospital, and then we were at Jefferson, we were at Penn Medicine, we were at Abington. It's been amazing. Now, the thing is that other people got involved, so we started seeing people early on get involved with this type of movement of feeding our healthcare workers and our first responders, which, thank God, I have no patent on this. This is something you should do. I think you should get in there. There's enough workers in there. There's enough restaurants to kind of help out to make this happen, And so we saw that early on. We were the only game in town. Then we started seeing people do it a little bit more. And then when the world started opening up, just like normal, we're a very myopic society, people forgot that our healthcare workers were still working and that they were still seeing patients, that we were still seeing death. We were still seeing severe issues with COVID. And so it started waxing and waning. We've been holding through to it. Donations stopped coming. So we had to think of events that we could use and events that we could start raising money for it and so on. So we've done multiple events. We've done multiple fundraisers with it. We have our donation line. If you go to, I think it's Text Hospital Heroes. What one was it? It was Text Hospital Heroes to 44321 to donate a meal. You can go to hospitalheroes.org or hospitalheroesfooddrive.org to donate a meal that way. But we kept it going. Now the surge has happened, and we're seeing that inundation again. And restaurants, here in the Delaware area, even in Philadelphia, restaurants are now requiring masks to come in, or they're requiring their vaccine cards and so forth. And there's a lot of places that are starting to shut down inside again. So we have to imagine that this is going to happen to the hospitals, even in the short term with it. So our hope is that we can continue this program to honor our hospital workers and honor our first responders. Our big take right now, and if anybody hears this out there, we want to get a couple of vans. We have a fundraiser drive that's going to be coming up shortly about getting vans to help us with delivery. Look, all of our volunteers that have delivered, myself that continues to deliver, we're doing it on our dime, basically. The money that's raised, all of it, 100% of it, goes into buying the meals and helping the restaurants. But I think, in the past 2 years, just to do these deliveries alone, I put about 40,000 miles on my vehicle just to do these deliveries alone. So, now we're asking for a little bit of a different fundraiser. We're saying, hey, help us procure a van, help us procure one of those sprinters or whatever it is, and then let's continue to feed this. This way, we can move it. So if there's anybody out there listening to it, if there's anybody out there that knows any car dealerships or anybody that would like to help us out, get a hold of us. You can go through thecopandtheshrink.com, or you can go through the hospitalheroesfooddrive.org and just help. That's really all that we can. Every meal that we do, trust me, it's amazing with it. We've seen I can't even tell you the number of meals. Typically, they're individual meals. They're packaged differently. We have had amazing partners. In Delaware, we've had V&M Bistro. Old Vincenza and Margarita over there. They have been amazing with their shop. Grotto's Pizza has been amazing to us. And when I say amazing, I mean amazing. I'll give these folks a call and say, look, I need 100 meals tomorrow. And they'll say, what time are you going to be here? So again, these folks have been just godsends to us. So again, if you get that opportunity, if you get that chance, if you want to honor one of these first responders, if you want to honor one of our healthcare workers with just a meal, it's pretty simple. It just costs us $6. $6 is kind of our point. Yeah, we've had people rail against it. I know that I've had, when I share the program with some of the restaurateurs, most of them are on board with it. Most of them are like, yeah, cool, no problem. But occasionally I get the folks that that aren't on board on it. Let me put it that way. They're just not 100% on board with it. So our goal is to get, between $6 and $7 a meal, because we have limited funds. That's kind of how it works. But I've had folks where they texted me or they've emailed me and said, "Hey, we want to be part of your program." I'm like, "Cool, this is the program. $6 to $7 for a meal. That we're going to get like 50 to 300 meals from you and all that." And I get the email back, "Well, we can't do anything under $20 a meal." And I go, "Okay, we don't need to feed these folks filet mignon. I'd love to, but we just don't need to." So again, I think it's for that struggling restaurant right now. Everybody's struggling a little bit. We can help. We can help our healthcare workers. We can help our first responders just by hitting over to the website and making a donation with it. So that's kind of the Hospital Heroes food drive. Started pretty simple with 125 burritos, and now we're 31,000 meals later. But please, do us a favor, do you a favor, do everybody a favor. Let's keep it going. Let's get this rolling with people. Let's make sure that we are taking care of our hospital heroes. Remember, text Hospital Heroes to 44321. Again, Hospital Heroes to 44321, and you could donate right on there, or just go to hospitalheroesfooddrive.org. You could donate. You could sign up to be a volunteer driver. You could sign up to be one of our partner restaurants and tell us what kind of cuisines you have and what you can offer us and so forth. But again, that's hospitalheroesfooddrive.org. If you haven't heard that website 3,000 times a day, I will say it again, hospitalheroesfooddrive.org. So again, thank you for listening to thecopandtheshrink.com. We're going to be back. Just a quick wrap up of everything that's going on. Thank our sponsors. And kind of move from here. And again, we are wishing the best of recoveries to the cop. We're wishing best recoveries to Harold, who's home right now. But we'll be back on the podcast as soon as he recovers. So again, thanks. Check us out, thecopandtheshrink.com.
The Division of Wellness Services of the National Fraternal Order of Police is committed to leading the efforts to ensure the well-being of law enforcement officers. The FOP intends to no longer react to issues of critical stress affecting its members, but instead take a pre-act approach that is driven by trained peer support, research, empowerment of officers, awareness and stigma reduction, connections to service, and ongoing training and development. Information about the Wellness Division, resources, and publications can be found at fop.net/officer wellness. Donations to the National FOP in support of their Division of Wellness Services and other programs can be made online at nfop.firstresponderprocessing.com.
All right, welcome back, folks, to The Cop and the Shrink. You can follow us on thecopandtheshrink.com. Today, again, it's just been the Shrink. The cop is out with the vid, with the Rona, but we wish Harold best of health. I know he'll be back. He'll be ready for this. Hopefully saltier than ever. I've been flying solo today, so hopefully you didn't get completely bored by any of my rantings. In this final section, we normally do our current events and so forth, and I just want to kind of thank our sponsors, thank the people that we've been working with, and ultimately just thank everybody that's been following and commenting and so forth. Also, to kind of give a little praise to my partner. Again, he's not here, but again, we've been some of the busiest people on the entire planet during this entire pandemic, and we've always been pretty busy people in general. But he takes his time. He comes in. We do the podcast together. He's just been amazing. He's been an amazing friend, but he's also been an amazing partner with the podcast. Also want to thank our producer, Denny, my son, who is back there that has to deal with our rantings and ravings and so on. But hey, it's the way it is. I'm his dad, and I'll flip him some money later or whatever. He's looking at me like, hell, you are. So a couple of things we want to thank. I know that we've said it before and we come across it a lot, But I wanted to thank a couple of people through the years that have really, really, really helped us with a bunch of stuff. The first thing that we always do, we tell you where to buy this stuff, some of our items and all. But I want to talk a second about Big Oyster Brewery. So Big Oyster Brewery was the one that developed our Survivors IPA, and then if you're looking online, we have a little can here, Survivors IPA. You can buy from, I think it's from Philadelphia out to Pittsburgh. We want to reintroduce it again and may make a hazy IPA out of it. But Big Oyster Brewery, two folks down there, Mike and Emily, great people. They came in and really I had this idea, and I know a lot of people have idea of what they like in beer and what they want to do, but I hadn't seen many charity beers. I hadn't seen beers devoted strictly to a foundation or to a cause or whatever it is. And when I sat down with them, I said, look, I've been the biggest cheerleader with Big Oyster since they've come on to the beer scene. And I said, how can we get this together? And we started developing this Survivors IPA, and it has just been pretty awesome. It's a great tasting beer. It's a light beer. It's a light IPA, which is unheard of, but it's a great tasting beer. But it was for Mike and Emily just to kind of believe in us, believe in what we could do, and believe in how we could do it. So it supports the Trauma Survivors Foundation. It also supports our Hospital Heroes food drive. More specifically, the beer itself, any proceeds that we get from it, helps us with our scholarship programs for our law enforcement scholarship and our firefighter scholarship. So those two scholarships under the Trauma Survivors Foundation are for the sons and daughters, the children of firefighters or police that are going into the psychology field, whether they are a high school senior or a college senior. That if you check it out, again, go to the traumasurvivorsfoundation.org or .com. You go there and you could read about it and read what this does. But Big Oyster Brewery stepped up and really helped us out with this. The other brewery that has been there, and I always shout out their name, that if you're ever in Delaware, check out Big Oyster, but also check out Bellefonte Brewery. Bellefonte has two locations, one over on Capitol Trail, one up on Marsh Road. But these are folks that are other ones that believed in. I honest to God, they have embraced us. So both of these breweries here in Delaware, they have come to help us out. They host events for us. They put us on social media. Bellefonte, we were the first charity where they did the charity of the month. So they came out, and every Monday they do a different charity for a whole month, where they take every pint of beer that they sell and donate $1 back to the charity. I think this month, January, is Delaware Autism. So two just amazing breweries here in Delaware that check out, give them a shout, pay them some visit. They've been great. And throughout the pandemic, they've been working their tails off. Bellefonte was funny. They opened up their second location up at Marsh Road. They call it B2, Bellefonte 2. They opened it up, I think it was February 15th. I could be wrong on that date. It was February 2020. And then we had the shutdown right afterwards, like literally, not even 30 days afterwards. So they've been fighting to get a following up there, and they're doing such a great job. So again, Big Oyster Brewery, Bellefonte Brewery, just wanted to make sure that you knew about them and to thank them from the bottom of our hearts that they have been just incredible people, incredible partners with this. So there's that. Now the other one we have, and we always put it up here if you're watching us on YouTube, we have our wine, the Captain's Punch wine by Wagon House Winery and the Three Boys brand. Another one. I can't say enough about these people. Heather and Dan out at Wagon House Winery. I went to them during the shutdown, wearing masks when we first met, everything, and said, look, I want to develop a wine, and I want to develop a wine in honor of Captain Alan Davis, our captain from the Chester Police Department, shot in the line of duty. Captain has been I lose words for how awesome he is. He is just one of those guys that that you could count on at every time. That if I had a problem with a younger officer where, the younger officer's thinking of quitting or thinking they can't get through some horrible incident, I call Captain Davis and he'll talk to him for hours and hours and hours. He's just that guy. So I wanted to honor him by having a wine that came from a tough exterior to a sweet person. And Dan was able to come up with our wine, which is a sweet red wine made with Concord grape. The Concord grape itself is the roughest skin of any of the grapes, but the sweetest insides. And then we always said that's because that's what the captain is, So we went back and forth. We developed this logo, and then finally we had the wine made. And the proceeds from this wine come to us, and it goes to our crisis intervention program, our mental health treatment with first responders and trauma survivors, and a small portion of it goes to the Hospital Heroes food drive. So if you get that chance, go to wagonhousewinery.com. They ship to most states in the United States. Buy a bottle, a case, several cases, whatever. It's an easy drinking wine. It tastes like a kicked up version of Welch's grape juice. I mean, it's actually a really, really pleasant wine. I'm a bold red guy. I like my Sangioveses. I like my Barolo's and all. I'm a bold red guy, but I could sit and drink this and be okay. This is a sweeter wine, but it's a cool wine to drink. So make sure you go to Wagon House Winery. Check them out for it. So those are the folks that have been helping us out. I wanted to pay a little homage to them today. I wanted to talk to them a little bit. Now, we also have another program, and one last one, that we've been working on. I actually redesigned the website to this one. This is our Survivors Coffee, our Survivor beverage company. So if you go to survivorscoffee.com, all right. Oh, Denny's He's handed me our Survivors Coffee, which is actually there. Thank you, Don. If you check it out, this one is actually our fresh roasted. This is our cowboy blend. So I guess after you drink it, you yell yeehaw or something. You kick up your heels and you yell yeehaw. No, that's stupid. So, but if I put it there, if you could see it, if you were looking online, we've actually redesigned the label. We've redesigned the packaging. The cool part about this, it's an online coffee company. You can order this anywhere. So you go onto our site. So we've changed the site over a little bit. It's a little more user-friendly. Survivorscoffee.com or even drinksurvivors.com. Order a bunch of it. It comes out fresh roasted. It's packed from our folks, our facilities with the coffee. There's K-cups involved with it. There's natural bean. You can get it grounded already. I'm not telling you. If you're a coffee drinker, you know all that. I have always been a black coffee drinker. I might have way early on started, with the creamery and the creams and doing sugars and all that. But truthfully, I just like a cup of black coffee, and I love tasting those different flavors and having those different aromas and all. And so we put up on this site several different varieties of coffee that you're going to enjoy. You're going to like it because it's coffee and it's good and it's happy and it makes you caffeinated and motivated and all that stuff. The thing about Survivors Coffee is that all the proceeds that we get from Survivors Coffee go to the Trauma Survivors Foundation, also go to original content here at the Cop and the Shrink, and also go to the Hospital Heroes food drive. So we're going to put up, probably our next podcast, we'll put up a couple of discounts for folks that if you're involved and want to get some coffee, some fresh coffee, again, get it, survivorscoffee.com. It's good stuff. So we're wrapping up today. Again, just me today, just the Shrink, the Cop. He is convalescing. He will be back. So I want to thank all of you that have been listening and watching. Without you, we're just talking kind of weird stuff. No, we're talking to an empty screen. But in all truth, thank you. Thank you for all the comments, all the well wishes about the podcast. Thank you for being the loyal listener to it. So remember, go to thecopandtheshrink.com. That's our big one. Go to the hospitalheroesfooddrive.org. Go to the traumasurvivorsfoundation.org. Follow us on all shades of social media. Make sure you flip on over to TikTok. We've been doing pretty fun things over there. And if you have any suggestions of a strange or bizarre law in your state or some psychological fun fact send us an email or comment on any of the comment sections under any of our posts. We would love to use it in a section here at The Cop and the Shrink. We would also love to put it up on TikTok or whatever. We want to be as interactive with you guys as possible. But again, remember, we do want to thank you from the bottom of our heart. This has been Dennis from The Cop and the Shrink. The Shrink, again, get well, Harold. We will see all of you next time. Thanks a lot.